What's special about this place is that all of the patient's needs were thought of, and it's nice that everything is accessible here in one space, on one unit, so to speak, and that's considering the person who is delivering as well as the baby. So, if God forbid baby needs a higher level of care, you don't have to drive to another building. You don't have to leave to go see your baby in the special care nursery. So that's really nice. Postpartum, it's right here. Everything we need is right here.
Mom wants to be heard. She wants to know that we are listening to things that she's afraid of, things that she wants for herself, things that she doesn't want during her labor. And that looks like having options, having the option to labor in the tub or to get into the shower, space to move her about in her room. Our rooms are really big and roomy. Every labor room has a window that looks outside and gets natural sunlight. It doesn't feel like you're in an operating room. It doesn't feel like you're here to be sick. There's space for partners and support people to be close by and to be hands-on and supporting their partner in labor. They want to know that there is midwifery care available to them, but there's also higher level medical care if needed. If something happens that they need an additional intervention, there's an OB on standby who can provide that. So it's the best of both worlds. They can be as normal as they can be, but if they need a higher level of care, we have that for them immediately available.
I'm proud of the work that we've done to care for the whole family. We thought about family members during the labor process, support people. We've thought about the baby with pediatricians and neonatology support available. We have our own respiratory therapist available in the event that they're needed.
We have a midwife here at all times, a physician here at all times, and a pediatric specialist here at all times. And in our special care nursery, we have access to specialists, to neurology and pulmonology, and all those specialists that might need to be consulted can happen here rather than having to go to a higher level of care. The special care nursery that we have here can take care of babies from 32 weeks and beyond. And so we can provide care for those babies 95% of the time with breathing support and extra support. And yet if it needs higher levels of care, we have that access too.
The hope is that your pregnancy is smooth sailing and we've got a nice full-term healthy baby. But in the instance where something might happen very quickly, which it can, we have an amazing nursing staff that has basically worked through our system, and also lactation consultants that are here to help your breastfeeding journey go as seamless as possible. Our midwifery staff is all experienced midwives that have caught thousands of babies, and we also have a very skilled obstetrical medical team for instances that would happen where a quick cesarean section would need to be done, a vacuum or forceps, also 24-hour in-house obstetric anesthesia.
There are some patients who prefer a very clinical setting that is a hospital setting, and then there are patients who prefer the polar opposite, very warm, very home feel, very inviting. So we have all of that. I think we did an especially great job of bringing together clinicians of a very diverse background, both clinically and, ethnically, racially, gender, everything. And so we have married this beautiful recipe of neonatal providers and nurses and OB/GYN providers and nurses of different levels of care. So we really are in a place where we can take care of the variety of patients that we see here. We are very multidisciplinary, but we are interdisciplinary in how we care for our patients. It's a team approach. There's a little overlap of some of the disciplines, but on purpose. It is I have your back sort of approach to care, and we know that the outcomes will be better for patients and our babies.